if you will manage your staff well, you take care of your staff will take care of you.
Welcome to AMC. I'm Dr. Greg Miller. We're in a series on staff training and support, and today's topic is going to be staff management with Dr. Todd Osborne. Let's go ahead and get started.
So let's talk about managing your team or staff management. And I know this is a big factor in so many chiropractic offices of why they're not able to reach their potential, why they're not able to grow, maybe why some of them struggle so much. And it can be a huge frustration for us as doctors. And what I hear many times from other people in the profession is, listen, I didn't go through chiropractic school to be a manager. I went through chiropractic school so that I could adjust patients and take care of patients and be with patients all day. And I understand that, and that's true. But here's the factor. You're a small business owner. You're an entrepreneur. So you either have to manage the staff or you have to pay someone that is able to manage the staff. And I can understand the fact that if you can't manage at least on the basic levels to get your practice to a certain business level, there's no way you can afford to pay someone to manage your team. So doctors have to manage at some level, and it may not be your favorite thing. It may not be your best attribute. It may be something that you don't really care to do, but it's something you have to do. Because in order to take care of the patients, what you really want to do, in order to take care of those patients, to spend time with them, to have your hands on them, to deliver those adjustments, to save their lives, you have to have a staff behind you. They have to be well trained and they have to be well managed. And so one of the big things is a lot of us don't know how to manage. So I would encourage you to get with someone that can help you learn how to do that. There are many different books out there that you can learn from, many programs now, of course, online, and there's lots of systems out there that can help you become a better manager. But I'm just going to give you a few points on it as we go through this today. Number one is hiring process. Do you have a process? Do you have a systematic way? Do you know what you're looking for in staff? Do you know who should be at the front desk? Who should be in therapy? What different type of personalities or different motivational DNAs are the best for those particular positions? And so you should have a process for getting the right people on board to start with. And here's what I always say, a great staff is not hired, great staff are developed. So you hire the right people, and then through your training, you develop incredible staff members or team members. So do you have an onboarding process or that initial training process when they come on board? Do you have a procedural manual in your office that they can refer to? And what is that onboarding process? Do you have a week, 2 weeks, a month? Do you have that training period so that they can go through and learn the aspects of it? Or do you just throw them in at the front desk and say, there it is, go for it? Do you have a way for them to answer the phone? Do you have a way for them to schedule and run your appointment book? So there should be systematic ways for all of that to happen so others can step into these positions, you can train them well, and you can develop that great staff. Here's another thing. When a new staff member comes on board, are they put through your new patient process from beginning to end so they understand completely what your patients are experiencing? And so if you will do that, that gives them a heads up on dealing with any of the new patients, answering questions, and so forth. Back to the procedural manual. Do you have that in place so everyone knows the way things are supposed to be done? Do they know the rules? Do they know how they're supposed to handle things in the office? If you don't have one of those, then it's a free-for-all, and you're micromanaging on everything. So try to get a great procedural manual put into place and then keep it updated. If you have a procedural manual that was from 20 years ago, probably not going to be that effective today because there's been a lot of changes in your office. And then, are you being coached? Is your practice being coached? Is your staff being coached? And what I mean by that is, doctor, either you need to be coaching your staff or you need to hire someone else to do it, because they need that. They need the feedback. They need the instruction. They need the encouragement. So someone needs to be coaching that staff. And so continued training. You do the initial training and then you have continued training. You should have a morning meeting every day, or a start of the day meeting, depending on when you guys are getting your day started, with the staff member. Be 15 to 20 minutes long, but it gets everybody on the same page. We know what we're doing for the day. We get focused in on our patients and what we're going to accomplish for that day. So that should be a daily basis, a daily occurrence in your practice. And then once a week, you should have an hour-long staff meeting. And this is where you can really get into training different procedures and retraining. And we know how that is. You put something in place and, a month down the road or 3 months down the road or 6 months down the road, all of a sudden it's gone, right? So you need to constantly be retraining so that you're going back and picking up the little things that you dropped and stopped doing, and make sure you're polishing those procedures so that you can have the most efficient and most productive clinic that you can possibly have. Do you take care of your staff? And what I mean by that is, do they have incentives to grow? Are there bonus incentives put into place so that the harder they work, it doesn't just fill your pocketbook, but the harder they work, they are actually gaining something from that too. And so that's a great incentive to put in place and help your staff. And that builds loyalty, that builds dedication, that builds productivity in your office. And here's the thing. Most staff members that don't do well, and we have a huge turnover ratio in our profession of staff, but most staff members that don't do well are not trained well, are not managed well. So I would encourage you, if you are not doing staff management, you need to start. If you don't know how to do that, you need to come to someone that knows how and learn how to do that. And I promise you, if you will manage your staff well, you take care of your staff will take care of you. Your team will be there to run that practice for you. And when you get it on that level, then it doesn't take micromanaging. It only takes the small amount of management per week, and you can keep the flow going.
Hi, my name is Dr. Jill Palma, and my husband and I practice in Leeds, Alabama, and we have been in practice almost 10 years. And we have found that a lot of our success comes from training our staff so that they are on the same page as we are. And the way that we do that is we have weekly staff meetings, daily staff meetings in the morning, just to make sure that everybody's on the same page. That way we're able to serve our patients better and communicate with them better.
Thanks for joining us today. As a reminder, we've got regular webinars that go into even more detail on this topic. Check the description for more ways to get our content and sign up. If you'd like more information about AMC and how it might help your practice, you can always reach out to us at amcfamily.com.